This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us today for our HealthyU webinar series. Today's webinar is a checklist for health after 60. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We'll answer as many questions as we can towards the end of the presentation. Your questions will also remain anonymous as always. Today's presenter is Dr. Heenal Mehta. Dr. Mehta received her medical degree from New York College of Osteopathic Medicine and completed her residency in internal medicine at Garnet Health Medical Center in Orange County, New York. She's excited to join the staff at Port Jefferson Internal Medicine, a practice of Harborview Medical Services. Dr. Mehta, thank you so much for joining us today, and you can go ahead and get us started.
Thank you so much, Emily, for the introduction. Hi, everyone. I'm Dr. Mehta. I'm so happy to be giving this lecture to this webinar to you today. Like Emily said, it's about a checklist for health after 60. So let's get started. They say the 60s are the new 40s, right? There's a study done in 2017 that shows that between 2006 and 2016, the population of 60 and over has increased about 36%, and it's going to double by 2060. And by 2030, 1 in 6 people will be over the age of 60. So why is this important? With preventative medicine, with continual health practices, with new treatments and medicines, longevity has increased. With longevity, though, comes a lot of chronic diseases. You know, as you get older, you have risks for getting arthritis, heart disease, COPD, strokes, obesity, dementia, cancer. So what's important is that we take care of this longevity. We allow you to have maximized life expectancy with treating these long-term disabling conditions with treatments. Taking care of your body. Taking care of your body is important at any age, but as you get older, your immune system wanes. Your immune system is not able to take care of itself as it was when you were 20 years old. So it's important that you do make healthy choices, see your doctor, and kind of reduce that likelihood that you're going to get illness. So how can I help you stay healthy longer? How can we in medicine help you stay healthy longer? My first and most important suggestion is exercise. Movement. I don't think we put enough emphasis on exercising. And I think one of the barriers to exercise is as you get older, there's a lot of things that you may be afraid of. You're afraid of falling, you're afraid of getting arthritis, you have a lot of aches and pains. So how do we kind of get over that barrier so that you exercise or move more? The reason movement is so important is that it helps decrease inflammation. It reduces your risk for fractures. It lowers your risk for diabetes, for cholesterol, for high blood pressure, and it even helps mental health. And exercising also will improve your heart and lung function. So it's very, very important. But I think the misconception is that, oh, you have to do high strenuous exercise to be healthy. That's not true at all. The most simple advice that I give my patients is walk. Walk about 30 minutes a day, and that will be very, very helpful in bringing your blood pressure down, bringing your cholesterol down. You know, if you're pre-diabetic, bringing that hemoglobin A1C down. And it doesn't just have to be walking. If you like biking, if you like hiking, if you like swimming, there's a lot of different exercises you can do. Tai Chi and yoga are really, really great exercises that are good for the joints. But moderate intensity exercise for 20 to 30 minutes a day for a total of 150 minutes is recommended. And trying to do some resistant training. Resistant training includes weights. And I know people are really, really scared about doing weights. They don't want to fracture or anything. They don't want to get hurt, but you don't necessarily have to use very, very heavy weights. You can use smaller weights. You can use your own body weight and do exercises. You can use resistant bands. So there's a lot of different options. Another question I get from patients all the time is, how many steps should I be getting a day? That varies. You know, any steps that you do, I think, is beneficial. But if you can try to get 10,000 steps a day, that would be the most beneficial for your health overall, because it helps reduce the risk of heart disease. But if you're able to do even 5,000 steps a day, that's phenomenal. So just getting any kind of movement and doing any kind of walking, any kind of exercise is helpful. And I love the saying, movement is medicine, because it's true. And, you know, some of the barriers we talked about, if you still feel like you still have some barriers, if you still feel nervous about doing exercise, get professional help. You know, I think in this day and age, we have so much available to us. We have so many resources: physical therapy, occupational therapy, there's fitness trainers, you can go to the gym. And I think there's a big misconception about physical therapy being only applicable when you get an injury. And I will say that even I was at fault for that. I thought, you know, physical therapy is something I do if I break my arm or I get fractured or if I have a torn muscle. That's not true. Physical therapy can actually be very, very helpful in stretching and strengthening your muscles. It can help with endurance so that you can do all these hobbies that you really love to do, like gardening, golf, hiking. And they can also teach you how to get up from a chair, how to prevent falls in the future. So, you know, getting help from physical therapy, getting help from occupational therapy can be very, very beneficial as well. But the important thing is you can modify your exercise routine to whatever helps you. It doesn't necessarily have to be what someone else has told you. It doesn't have to be strenuous. Any type of movement is going to make your health better. And I know because of COVID, a lot of my patients have told me, I'm afraid to go to the gym. I'm afraid to go outside. I'm afraid to do this. There's so much available to us. There are a lot of apps out there that can be very, very beneficial too. Some of these that I put up, Map My Walk, Fit On, the Johnson & Johnson official 7-minute workout. These are all great apps that you can use to help you at home do very simple exercises for 20 to 30 minutes a day. And YouTube videos are really, really great if you want to try to get 10K steps in or 5K steps in. You don't want to go outside because it's really cold. YouTube has stationary videos where you can be in just your living room and get 10K steps in just by doing the exercise they show you on the video. And also Fitbit and Apple are great watches that can help and aid you in your movement. So they can calculate how many steps you're getting a day. They can calculate, they can measure your heart rate. They can measure your oxygen levels. So these are great additions to exercise that can help you. Now food, I think food is another big thing that I think don't put enough emphasis in. We can always improve on what we're eating. I always tell my patients, eat a very balanced and nutritious diet. But what does that mean? Are you eating a lot of foods with fruits and vegetables and lean meats? Are you eating a lot of salads? Are you eating antioxidants? But what should we eat less of? What should we eat in moderation? So carbohydrates, right? Foods such as breads, rice, pastas, potatoes, lots of things we like to eat, cakes, cookies, bagels. Are you eating that in moderation? Are you eating salt in moderation? Do you put salt in every meal that you eat? Because salt can cause you to have high blood pressure. Maybe if you decrease your salt intake, your blood pressure would come down. What about fats? Are you eating a lot of fried food? Are you eating fried chicken, French fries? Do you use a lot of processed oils? Are you eating cheese, butter, egg yolks? Are you eating processed meats? I know bacon is very popular, sausage, hot dogs, trying to cut down on these things. So I never tell anybody to stop any foods that they like, right? Because food is life. We love food. But everything in moderation is going to help you get healthier. Now, how do we make something more balanced? How do we eat more balanced? Eat smaller portions and have 4 meals a day. Some patients come in and tell me I eat 1 meal a day or 2 meals a day. And then when we kind of discuss it further, those meals are very, very extensive. There's a lot of carbohydrates in those meals. But maybe if you had more portioned out meals for breakfast, lunch, and dinner, you wouldn't be eating so many carbohydrates in one meal. Maybe if you're putting more emphasis on protein, fibers, and fats first before sugars and carbs, then you would be more fuller and you wouldn't be going for that extra portion of pasta or that extra piece of steak. The next slide shows a plate that I really, really love, and I always like to show my patients. And I try to get them to cater each meal to look like this. Now, when you plate your food, does half of it have fruits and vegetables? Now, usually when we eat pasta, right, we eat pasta with sauce and it's like a whole bowl of pasta. Instead, it should just be 1/4 of a bowl of pasta. Half of it should be vegetables, and the other half should include either dairy or some protein or some meats and some fat. Trying to cater each meal that you have, not including your snacks, but more so your breakfast, your lunch, and your dinner in this way is going to make you eat more nutritious, eat more balanced, and it's going to help with your cholesterol. It's going to help with your diabetes. It's going to help with your blood pressure and just your overall health. Now, if you need more help with this, that's what you can talk to a professional about. Sometimes I like to tell my patients, why don't you log everything that you've been eating for a week and kind of bring it to your doctor. This way they can kind of see what you're eating more heavy of. If you have specific allergies, if you have specific cultural or ethnic needs, talk to a dietitian, talk to a nutritionist. They could be very, very helpful in helping you decide what choices you may be making that are not as good and how we can make improvements on it. And there's also, just like there were a lot of exercise apps, there's a lot of food apps that are really, really helpful. MyFitnessPal is one of the best ones that I've used, where you can kind of put in your information. That'll ask you for your weight, it'll ask you for your height. You can put in, how sedentary or how active you are and how much you want to lose weight, how much you want to get healthy, and then they can kind of cater it to you and tell you, maybe this is how many calories you should be eating in a day if you want to maintain weight. This is how many calories you should be eating in a day if you want to lose some weight. And just putting in your foods kind of will show you, it'll just give you a good education on, how many calories you're eating a day, maybe some unnecessary things that are eating. Maybe if I ate 20 pretzels, it would be the same number of calories if I ate 3 oranges. And wouldn't it be more beneficial if I ate those 3 oranges, because it would make me feel fuller and I would be eating something nutritious. And drinks, this is very, very important. I think people don't realize how important or how much effect sugary drinks that we drink on a day-to-day basis can make. Are you drinking enough water? Drinking 6 to 8 glasses of water a day is very, very important. It actually helps a lot with the bloating. It's going to help with your blood pressure as well, but you have to make sure you don't have any, you should talk to your doctor and make sure you don't have any heart failure or nephrotic syndrome or some kind of liver disease where you're not supposed to be drinking a lot of water. But cutting down on sugary drinks, cutting down on putting that sugar in your coffee, cutting down on drinking those sweetened sodas, cutting down on fruit juices, sweetened iced teas, and also limiting your alcohol. I think another thing that we don't realize is that we might be drinking a lot more alcohol than is beneficial for us. Usually it's recommended that women drink no more than 1 drink per day, and men it's 2 drinks per day. So if you're already drinking more than that, you're already drinking more than is recommended for your health. But making those cuts and moderations are going to be great for helping you with diabetes, with your blood pressure, and with your cholesterol and heart rate. Sleeping is something that I think is very, very underrated. I think people don't put enough emphasis on. Are you getting 7 to 8 hours of sleep a day? Because you should be. And if not, why? I think as you get older, it does get a lot harder for you to get enough sleep. But sleep is very, very important because that's when your body repairs. That's when it relaxes, it reduces your stress levels, it helps you have a better memory, better concentration, and it also helps you lose weight. But if you're having a hard time sleeping, why? I think sleep patterns kind of change as you get older and older. And so you might be having some insomnia. Could it be because you're having a lot of inactivity during the day? Could it be because you have a lot of caffeine during the day? Maybe you're drinking 4 glasses of coffee. Are you very anxious? Do you lay awake during the night thinking, I have this, and this to do. What am I going to do? Or maybe you have some kind of sleep disorder that was never diagnosed. Do you have sleep apnea? Do you feel like you wake up, when you wake up, you're still very sleepy during the day? Do you have restless leg syndrome? Do your legs move around all night and you can't really get proper sleep? So kind of figuring out why you have that issue, why your sleep isn't doing so well, and talking to your doctor so that you can figure out the underlying cause and kind of treat it so that you can get proper sleep. Now, sleep hygiene is also very, very important. I think we as a community and a society are not getting a lot of good sleep because in our day and age of technology, we have so much stimulation. We have a television that maybe is on. We are looking at our phone. Maybe we're looking on Instagram or WhatsApp. So winding down an hour before bed. So let's say your bedtime is 10 p.m. Turn off all your electronics at 9 p.m. Sit in a dim room, maybe read a book, maybe drink a calming tea, meditate, but making sure that you kind of do things that don't stimulate your brain. That will make your brain realize that maybe it's time for you to go to bed. And also just using the bedroom only for sleep and intercourse is really, really helpful. I think, maybe if you use it for other things, your brain might be getting confused and that's why you're not able to sleep in that area. The next thing, I think we talked about diet, we talked about exercise, and we talked about sleep, but also a lot of this correlates with seeing your doctor, getting a physical. Patients always ask me, why do I have to see you so often? I'm pretty healthy. Do I really need to come and see you? Well, the reason why it's important to come and see your doctor is because it helps assess whether or not there's some healthcare issues that might be underlying that we may be able to catch early on. Sometimes you may not have symptoms, but with your physician being able to see you, do a physical exam, test your blood, check your blood pressure, check your sugars, we might find an undetected diabetes. We might find an undetected high blood pressure or cholesterol. And the earlier we're able to diagnose these things, the more we're able to prevent further issues in the future, or able to prevent strokes in the future or heart attacks in the future. So it's really, really important that you see your doctor at least once a year, if not, more than once a year. And especially if you have any acute symptoms, right? As you get older, your immune system isn't as strong as it was when you were in your 20s. So a mild cold or a mild flu can turn into pneumonia. A UTI can turn into sepsis. So it's important that you see your doctor for concerns that you have. And when you go see your doctor, it's important to talk about your medications. Make sure you're taking your medications regularly. And if you're not, what are the barriers to this? Are you afraid? Are you afraid of potential side effects that you may have? You can go to the next slide. Are you afraid of potential side effects that have occurred for other family members that you're afraid of? What may be the cost? Maybe your insurance doesn't cover it. Don't just let it go and not take your medication. Call your doctor's office and we can work with the pharmacy to find another medication that might be appropriate for you and cost effective. Is there some kind of misunderstanding or do you have some mistrust? That's why communication is key. Talk to your doctor about why you're hesitant about taking some kind of medication. Are you on maybe too many medications? I know as you get older, sometimes the medications kind of build up and then you're not able to remember how many you're supposed to take. It's just too much and you can't do it. Talk to your doctor about maybe cutting down on medication or maybe finding alternatives so that you don't have to feel like you're taking too much. And then also try to get organized. Sometimes using a pill box is really helpful. Setting up your medications on a Sunday night so that you have all your medications set up for the rest of the week, so you don't have to worry about it and you just take it from the pill box is really helpful. And some pharmacies actually do blister packs and they set up these medications for you so you don't have to worry about them. And make sure to bring all your medications to your primary care doctor, because I know you see your regular doctor, but you may be also seeing some specialists, and the doctor may not know all the medications you're on. It's also important to tell them about all the over-the-counter medications you're taking and supplements that you're using, because sometimes there's some interactions that we kind of need to make sure are not affecting your day-to-day life. And just regularly going through all your medications at home at least once a month, making sure any medications that are expired you kind of dispose of, any medications that you're no longer taking you dispose of. And if you need help with that, you can also talk to your office and they can help you dispose of that medication too. Another thing I get asked about a lot is about, should I be taking vitamins? I think this is a very, very common problem. People are very, very concerned and confused about what supplements they should be taking. Now, before you take supplements, though, I always recommend you talk to your doctor, because you could be on prescription medications that interact with your supplements. Are you maybe taking the incorrect dose? I have a lot of patients that are actually taking much higher dose of vitamin D than they should be taking. And when you're taking incorrect doses, it can lead to complications in the future. You can get, kidney stones, or you can get some kind of problem. So it's always important to make sure that you're taking the correct dosage. Are you taking unnecessary vitamins? Maybe your vitamin D level is normal and you don't really need it, and the amount of vitamin D you get from the sun is enough. So always talk to your doctor about that, because they might want to take blood and check your vitamin levels. They might want to check your electrolytes, and you might have some deficiencies that they know about from just your past medical history, such as if you had bypass surgery. Could you possibly be deficient in iron? Could you possibly be deficient in B12? So those are things that they would want to check. Okay, now let's talk about vaccines. Okay, I know there's a lot of misinformation out there about vaccines and whether you should be vaccinated. So this is something I really, really want you to talk to your doctor about. If you ever have any hesitation, if you ever hear something from a neighbor saying, I got the COVID vaccine and then I got COVID, I got the flu vaccine and then he ended up in the hospital, talk to your doctor about any confusion you may have, because they're the best people to help you, help tell you what, in reality, if the vaccines can get you sick or not, which is they cannot. Your immune system wanes as you get older, and that's why it's really, really important for you to get vaccinated. So here I put a list of the vaccines you should be getting as you get older, especially after 60. Are you getting your flu vaccine yearly? Because every year we have 3 flu strains that are the most common in the air, and those are the strains that are put into the vaccine. So just because you got a vaccine last year doesn't mean you're protected from the flu this year. Now, just because you get the flu vaccine doesn't mean I will never get the flu. No, that's not true, because there are multiple strains of the flu out in the air. So you can still get the flu. Doesn't mean that you won't get the flu, but it will protect you from the 3 most prevalent flu strains in the air, and it will prevent you from getting a really, really bad case. The COVID vaccines, right now it's recommended to get the full 2 COVID vaccines plus the booster. We don't currently only have 1 booster recommended, but are you up to date on all your COVID vaccines? Are you up to date on your shingles vaccine? Shingles vaccine is recommended after the age of 50. Now, shingles is a horrible, horrible disease that people get as you get older, and you can get it when you're young too if you're immunocompromised. But as you get older, since your immune system wanes, you can come in contact with a family member who has shingles. You may not know that they have shingles, and you catch it from them. And the reason why it's such a horrible disease is that when you get the rash may disappear after a few weeks, but you may have neuropathic pain for 3 months after, which is very, very painful. So making sure you get the shingles vaccine to protect you from getting the shingles. And then pneumonia vaccine. After the age of 65, it's recommended to get the pneumonia vaccine, and you actually may be precluded to get it earlier if you're immunocompromised or you have some kind of illness that allows you to get it earlier than 65 and then again at 65. So it's important to talk to your doctor about making sure you're up to date on all your vaccines as well. And then just having better habits. If you're smoking, quit today. It's never too old to stop smoking. Anytime you stop smoking, you're decreasing your risk of getting lung cancer, and you're decreasing your risk of COPD. I know there's a lot of medications out there to help. I know, there's nicotine patches, nicotine gums, and some people may not like that, but there are other medications to talk to your doctor about that might help you quit smoking. And there's also support groups. So there's a lot of different ways that we can try to get you help so that you can quit smoking, but talk to your doctor and maybe formulate a plan so that you can stop. And then next we're going to talk about is screening. Have you gotten all of your screening done? After age 45, it's recommended that everyone get screened for colon cancer. Have you gotten a colonoscopy? And if you have, did you have any positive results that you may need a earlier repeat colonoscopy for? Have you gotten your repeat colonoscopy? And then for women, cervical cancer, usually cervical cancer screening is done after age 30 and usually can stop around 60, 65, depending on what your last result was. Were all of your pap smears normal, or did you have a positive pap smear and you still need to get a cervical cancer screening done? Did you get your mammogram? Mammogram is recommended every 2 years unless you have some kind of nodule or some calcification. But have you made sure that you've gotten your mammogram every 2 years? Lung cancer screening. Now, if you're a smoker and if you smoked, if you're currently smoking, or if you previously smoked 15 years ago, if you've had a 20-year history of smoking, it's recommended that you get a low-dose CT scan after age 50 so that we can assess for lung cancer and make sure you don't have nodules. And if you do have nodules, it's something that we can monitor. Any man who's ever smoked should get an abdominal ultrasound to assess for abdominal aortic aneurysms after age 65. Have you gotten that done? If you're a female after the age of 65, have you gotten a DEXA scan to assess for if you have osteoporosis, because women are at a higher risk for getting osteoporosis due to estrogen and because of your period. So have you gotten that done? Or if you're a male and you're at high risk, if you've had fractures before and multiple falls, maybe after the age of 70, you're at risk for osteoporosis. Have you gotten a DEXA scan done for you? And then this is another question I get asked quite frequently, prostate cancer. So actually it's not recommended to test for or screen for prostate cancer, but maybe you have some risk factors. Do you have family history of it? Are you having problems with your prostate? These are important things to discuss with your doctor. And the more you see your doctor, the more physicals you have or annuals you have, the more you see them, the more they can assess for all of these screenings. They can assess whether you've gotten all your vaccines. And the last thing I really want to talk about is depression and anxiety. I think this isn't discussed enough with patients, and I think there's this other misconception that anxiety and depression is just for young people. It's not for elderly people, but that's not true. About 20% of people age 55 plus actually experience some type of mental illness. And mental distress can affect you in many ways. It can prevent you from having good relationships with your family members. It can prevent you from working. It can prevent you from maintaining a household, from eating well. And some of the things that some of the mental illnesses or mental concerns that you may have is depression, anxiety, maybe some cognitive deficiencies. Maybe you feel like you're very forgetful. Maybe you feel like your mood's really off. So making sure you talk to your doctor about this. A lot of causes of depression can be, having a lot of chronic illnesses. As you get older, you can have all these healthcare problems and you're just tired. It's too much for you. Are you feeling lonely? Maybe you have some social isolation. And then having a lot of anxiety and stress, maybe it's interfering with your day-to-day activity. You're not living your, utmost life that you can live. You're not living the best life you can live. So talking to your doctor about this is very important. Now, if there's something emergent, if you have thoughts of hurting yourself, hurting someone else, obviously call 911. Go to the ER or call one of these toll-free numbers to help you. But if it's just something underlying that you feel like you want to discuss with your doctor, you just don't feel like you have the energy to get up in the morning, you feel tired, you feel not happy, you feel stressed, talk to your doctor and ask for behavioral health referral if needed. but there's a lot of resources out there to help you, and I don't want you to feel like you're alone. Now, I guess let's go through our checklist, okay? So this is going to help us decide whether or not you're on the route to healthy living after age 60. Did you get an annual physical, or at least did you see your doctor within the past 6 months? Do you exercise daily? Do you have a balanced diet that's very nutritious? Are you sleeping about 7 to 8 hours a day? Are you taking all your medications? Have you discussed all your supplements with your doctor? Are you up to date with all your vaccinations? Have you done all of your healthcare screenings? Have you quit smoking? Are you drinking alcohol in moderation? And have you talked to your doctor about mental health? If you checked yes to all of these, then you're on the right path. But if you haven't, take charge of your health right now, and let's do this together. Talk to your doctor, make an appointment. This is our office at Port Jefferson Internal Medicine, and me and my colleagues, you can come and visit us anytime. And if you guys have any questions, I'm here for any questions.
Dr. Mehta, thank you so much for taking the time to speak with us today. That was a fantastic presentation. We do have a couple of questions that we can go over. Can you discuss non-Parkinson tremors, especially when you're using your hands?
Okay, so so there's different types of tremors. There's resting tremors, and then there's activity tremors. So it depends on what kind of tremors you have. Now, is it actually a tremor, or maybe you could have some vitamin deficiency? I think that's why it's important to see your doctor to kind of have them assess whether or not there's maybe one of your electrolytes, maybe a magnesium or a potassium, something could be off. And is it actually a tremor? And are you having the tremor just at rest, and then it gets better when you're doing activities like picking up water bottle? Or does it only happen with when you're writing something and your writing is off? So kind of assessing that. I think it's a little hard to talk about all these types of tremors, but I think it's definitely something you want to discuss with your doctor to kind of see if there's something underlying that you don't want to get missed.
I have trouble sleeping because people and pets frequently wake me up. Any suggestions?
Okay. That is hard. I think I don't know if it's people, like, is it like a spouse or a partner that you're sleeping with? Are they snoring? Maybe it's beneficial for you to use earplugs to sleep. I don't know if you're a light sleeper, and if pets are waking you up frequently, is there something else you can do? Can you have your pet in a different area? And why are they waking up at night? I think you kind of have to flush that out a little bit to kind of see what you can do. I really don't know what else to how to help with that, but maybe just seeing if maybe you could sleep in another room as your spouse if they're waking up a lot, and seeing if that helps.
How important is maintaining an optimum microbiome for health in 60+ people, and what foods are recommended for that?
Okay, that's a great question. I think that's very, very important. And I think, a lot of people use like over-the-counter probiotics, which are totally okay to use as well. But eating things like yogurt are also going to help with your microbiome as well. I think when it's the most important is when you're on antibiotics. Anytime I put any of my patients on antibiotics, I always tell them to take some kind of probiotics or to take yogurt, because as you get older, your gut is not going to be the same as it was before, and you're going to be at a higher risk for antibiotics kind of killing off the good bacteria in your stomach. So making sure when you're on antibiotics, always taking extra probiotics or kombucha or yogurt, anything that kind of gives you good probiotics. But if you wanted to take over-the-counter ones, I would still speak to your doctor about it. But just general yogurt is good for that as well.
Is there a screening for pancreatic cancer?
So there is not a screening for pancreatic cancer specifically, but if you have a risk factor, if a family member had it, there are some things that are hereditary. So I would definitely talk to your doctor about it and see if there's something else that they can do. Just getting even normal blood work can kind of help see if maybe, you know, your liver function is good, because your liver, your pancreas, your gallbladder, they all kind of, you know, are in the same area, kind of help each other out. So maybe if something else is off, it could give them more information, and just going to see them and them doing a physical exam, I think is also going to help. If you have any issues like epigastric pain, which is pain right underneath where like your sternum is, that's something you want to talk to your doctor about.
How do you find a good nutritionist?
That's a good question too. I think maybe just asking your doctor. Usually each practice or each hospital has a dietitian or a nutritionist that they work with. We have one at Mather who's really, really phenomenal. I've sent a lot of patients to. So maybe just ask for a referral. It's really hard to do online because there's so many people out there and you don't know for sure if, you know, this person is gonna work well with you or not. So asking your doctor.
Yeah, I can actually follow up on that as well.
Awesome.
We get a lot of people who go to our medical weight management program. Is that what you're talking about, Dr. Mehta?
Yes, yeah.
Yeah, they're fantastic. They do like a 12-week intensive with you, and they just follow you along and make sure you're staying consistent and set you up with the right tools to succeed. That number, if anybody's interested in our medical weight management program, it's full of our registered dietitians. It's 631-686-2513. And the next question we have, how important do you feel it is to monitor your heart rate while you're exercising?
I usually don't recommend it. I think some people like to, but if you have any concerns, like, do you feel like your heart rate is getting too fast? If your chest is hurting, it's okay to monitor and then just let your doctor know. Maybe bring a log of what your heart rate looks like every time you're exercising. Keep a log of it and then bring it to your doctor so they can kind of assess whether it seems appropriate or not.
Do you recommend wearing a mask at the gym?
This is a really good question, and I go back and forth. So when Omicron was really, really at its high peak, I was recommending it to everybody. Now that it's gotten better, I think it's a personal choice. You know, when I go outside, I usually do wear my mask, and especially if I'm around a lot of people. But if it makes you uncomfortable, if you feel like you can't breathe and your gym is really good about making sure people are vaccinated, then that's a decision you can make to not wear your mask, but just make sure you're using a lot of hand sanitizer, you're washing your hands frequently. And I know people tend to do this where we sweat and we touch our face. Don't, you know, touch your face with your hands if you're using equipment.
Can you offer any general dietary, vitamin, or other recommendations for someone with osteoporosis? Thank you so much.
Sure. I definitely think this you should talk to your doctor about, because I would want to know what your scoring is on your DEXA. You know, I need to know if you're already on medication or not for osteoporosis. Usually some doctors will recommend calcium or vitamin D as well, but it just depends on what medications you're on, what your levels are. So I would definitely talk to your doctor about that. You know, they always say, right, drinking milk is good for your bones. So I think things like that, but I would definitely talk to your doctor, because I need to know whether you're on medication or not, and which type of medication you're on. But usually vitamin D and calcium are two supplements that are usually recommended for osteoporosis, but you should talk to your doctor to make sure it's right for you.
Can blood work be done without fasting when screening for cholesterol?
So it can, but I prefer checking patients' cholesterol while they're fasted. Even if you did eat, you know, your cholesterol is not going to be that much higher. If it is high already, it's still, you know, when you do it fasted is the best way to know. But even if you ate a little bit, your blood pressure, your cholesterol is still going to be high, but it wouldn't be that much higher. So it's okay if it wasn't done fasted. You know, the next time you do it, when you screen for cholesterol, just make sure you try to do it fasted.
Okay, great. Looks like that is all in the questions that we have. Dr. Mehta, I just wanted to thank you so much for joining us today. That was a great presentation. If you're interested in making an appointment, there's the number on the screen for Port Jefferson Internal Medicine. And if you could all please just fill out the brief survey that you'll be receiving right after the webinar. It just helps us learn a little bit more about what you guys are interested in hearing about from us. Thank you, everybody, and enjoy the rest of your day.
Thank you.